When most people think of liver damage, alcohol is the first culprit that comes to mind, but it's far from the only threat. Your liver quietly handles over 500 vital functions, often showing no symptoms until serious damage is done. That's why it's crucial to recognize the subtle, sometimes strange signs your body might be sending. Today we're uncovering 6 weird signals that could mean your liver is in trouble. Let's dive in. First up, let's talk about jaundice, a condition that's hard to miss, thanks to its most obvious sign, a yellowish tint to your skin and the whites of your eyes. This yellowing can be subtle at first, but as it progresses it becomes more noticeable, often prompting people to check their reflection and wonder what's going on. The yellow color is caused by a buildup of a substance called bilirubin, which is a yellow pigment produced when your body breaks down old red blood cells. Normally your liver processes bilirubin and helps remove it from your body. But if your liver isn't working properly, maybe because of an infection, inflammation, or a blockage in the bile ducts, bilirubin can't be processed efficiently. Instead, it starts to accumulate in your bloodstream, eventually showing up in your skin and eyes. This buildup is what causes the classic yellow appearance. The change can happen gradually or quite suddenly, depending on the underlying cause. Sometimes people also notice dark urine or pale stools, which are additional signs that something's not right with the liver. It's important to remember that jaundice itself isn't a disease, it's a symptom, a warning sign from your body. Most often it's linked to liver problems like hepatitis, cirrhosis, or even blockages in the bile ducts caused by gallstones or tumors. In newborns, jaundice is common and usually harmless, but in adults, it's a red flag that needs attention. If you or someone you know notices yellowing of the skin or eyes, don't ignore it. It's crucial to see a doctor as soon as possible, because early diagnosis can make a big difference in treatment and recovery. Doctors will usually start with blood tests to check how well your liver is working and to look for signs of infection or blockage. Sometimes, imaging tests like ultrasounds or CT scans are needed to get a clearer picture of what's going on inside. Remember, jaundice is your body's bright yellow alert that something's wrong. Paying attention to this signal and seeking medical help quickly can help protect your liver and your overall health. Next, profound fatigue. More than just being tired. If you're exhausted for weeks, even after rest, your liver might be to blame. The liver manages energy by storing and releasing glucose. When it's damaged, this system fails. Toxins can also build up, making you feel foggy and drained. Don't ignore persistent, unexplained fatigue. It's a common but overlooked sign of liver trouble. Talk to your doctor if you're running on empty for no clear reason. Third, let's talk about relentless itching, also known as pruritus, that appears without any obvious rash or visible cause. This kind of itch can be incredibly frustrating, often making people feel uncomfortable and even embarrassed, especially when it happens in public or interrupts daily activities. Unlike the occasional itch that everyone experiences, pruritus linked to liver problems is persistent and can become a constant source of distress. When the liver is damaged or not functioning properly, it struggles to process and remove bile from the body. As a result, bile salts can build up in the bloodstream. These bile salts then travel throughout the body and irritate nerve endings in the skin, causing an intense itch that comes from deep within, not just on the surface. This is why people with liver issues often experience itching, even though their skin looks completely normal. The sensation is often described as maddening, and it tends to get worse at night, making it difficult to fall asleep or stay asleep. No matter how much you scratch, the itch doesn't go away, and over-the-counter creams or lotions rarely provide any relief. This can lead to exhaustion, irritability, and even anxiety, as the constant urge to scratch disrupts both rest and peace of mind. If you find yourself scratching constantly, especially on your hands, feet, arms, or legs, and there's no visible rash or allergy, it's important to pay close attention. This type of itching is often most pronounced on the palms of the hands and the soles of the feet, but it can affect any part of the body. While itchy skin can be caused by many things, like dry weather, allergies, or skin conditions, persistent, unexplained itching that doesn't go away is a red flag, especially if you have other symptoms or risk factors for liver disease. It's a sign that something deeper may be going on inside your body. Don't ignore it or simply hope it will resolve on its own. If the itch is ongoing and nothing seems to help, it's time to take it seriously and seek medical advice. Remember, your skin can be an early warning system for problems with your liver or bile ducts. If you notice persistent itching, especially without a clear cause, talk to your doctor. Early detection and treatment can make a big difference in your health and quality of life. Fourth, let's talk about dark urine, specifically, urine that appears brown, tea-colored, or even cola-like, rather than the usual pale yellow. This isn't just a minor change, it's a signal your body is sending you that something could be wrong. Many people might overlook this, thinking it's just dehydration or something they ate, but it can be much more serious. When your liver isn't able to process bilirubin, a yellowish substance produced during the normal breakdown of red blood cells, your kidneys step in to help. But they can only do so much. The excess bilirubin gets filtered out through your urine, causing it to turn a noticeably darker shade. This is your body's way of compensating for the liver struggle, and it's a warning sign that shouldn't be ignored. In fact, dark urine can be one of the very first signs that your liver isn't functioning properly, sometimes even before you notice yellowing of the skin or eyes, known as jaundice. It's an early clue that something is off, and catching it early can make a big difference in your health outcomes. Of course, there are other reasons your urine might be dark. Dehydration is a common cause, as is eating certain foods, like beets or blackberries, or taking some medications and supplements. But if you've ruled out these possibilities, and your urine remains dark for more than a day or two, it's time to take it seriously and consult a healthcare professional. Remember, your urine acts as a direct report card from your liver. It's one of the simplest ways your body communicates what's happening inside, especially when it comes to liver health. Doctors often use urine tests to get early clues about liver function, so don't underestimate what this change could mean. If you notice a sudden, persistent change in the color of your urine, especially if it's dark and doesn't improve with hydration, don't ignore it. This is your body's way of asking for help, and early action can prevent more serious problems down the line. Ultimately, dark urine is a clear and important sign that your liver may need attention. Listen to your body, and don't hesitate to reach out to a healthcare provider if you're concerned. Taking action early can make all the difference for your liver and your overall health. Fifth, pale or clay-colored stools. Healthy stool is brown thanks to bile pigments from the liver. If bile can't reach your intestines, due to liver damage or a blocked bile duct, stools lose their color. This often appears alongside dark urine and jaundice. Consistently pale stools are a medical emergency. If you notice this, especially with other symptoms, see a doctor immediately. Finally, easy bruising or unexplained bruises. The liver makes proteins that help your blood clot. When it's damaged, you bruise or bleed more easily, even from minor bumps. If you notice frequent or large bruises, or cuts that bleed longer than usual, don't ignore it. This can signal advanced liver disease. Your skin is showing you what's happening inside. Get checked if bruising becomes a pattern. Those are 6 strange signs your liver might be in trouble. Early action is key. Your liver can heal, but only if you catch problems soon. If you notice any of these symptoms, don't panic, but do talk to a healthcare professional. Listen to your body. It's smarter than you think. Thanks for watching, stay healthy, and see you next time.